Good afternoon, and again, welcome to today's health insurance webinar, Traveling Near or Far, a discussion about using your Columbia Student Health Insurance Plan when you are traveling during the academic year or over break. My name is Gail Gachalian. I'm the Director of Communications here at Columbia Health, and I just want to go over a few administrative items before I hand you over to our amazing speakers today from the Student Health Insurance team. So first and foremost, this webinar is being recorded. So we will send a follow-up email to attendees and non-attendees alike, so you can reference this information at your leisure. Second, if you require closed captioning, please press the captions button at the bottom of your Zoom toolbar. And last but not the least, we will be leaving time for questions at the end of this session. So please enter your questions via the Q&A function, and we will get to those questions throughout the presentation and or after. So without further ado, I'd like to hand you over to our health insurance specialist, Cynthia Razzo. Cynthia?
Thank you, Gail. Hi, everyone. My name is Cynthia. I am your health insurance specialist here at Columbia Health. And joining me is Karen. She is our assistant director of student insurance. So we'll be here to guide you on how to use your insurance while you're on your break, traveling near or far, or actually anytime, doesn't have to be. Thank you for joining us. So let's get started. So we are here today with the Student Health Insurance Office. If you haven't been to our monthly webinars, we do have them on different subjects throughout the year. We are here to help you access affordable health care with your insurance. We are not employed by Aetna. We do work for Columbia, so we are here for you to assist you in understanding, utilizing your insurance. We can assist you with all your questions about coverage, how to get a referral, what to do about a claim, things like that. So, how to use your insurance while traveling. Again, thank you for coming. And hopefully, if you have friends, other students on the insurance plan that are traveling while they're on their breaks, please let them know this will be available to them. This information will be available to them, and they can contact us as well. So, if you are traveling and need to see a doctor, what do you do? Well, there's a few things. Are you still near campus? If you are within 50 miles of campus, you would just use your insurance as normal. By this time, you should be familiar with how to get a referral and the need to get a referral prior to seeking treatment. If you need to go to the emergency room or urgent care, you do not require a referral first. However, you do need to get one before you are seen for any treatment afterwards. If you need to get a referral and you're within the 50 miles of campus, just visit the patient portal at secure.health.columbia.edu and make an appointment with medical services or consulting psychological services. Okay, so are you still in the United States? If you are traveling home to your home state, or you're visiting friends in California or Texas, you do not require a referral as long as you are over 50 miles. All you would do would be to use Aetna's online directory to find your in-network physician, urgent care, or emergency room. Make sure to have that ID available on the website. You can get it at aetnastudenthealth.com to access both the directory and your digital ID. Also, be prepared to pay your copay. If you're going to an Aetna network physician and you're just going for a medical visit, be prepared to pay that $30 copay for a specialist. Urgent care would be $60 and emergency room would be $150. If you have left the US, if you're traveling, let's say to your home country, or you're just traveling the world, it's a little different. You want to select a provider of your choice in whatever country you're in, and you may have to pay out-of-pocket fees for your services. You will Once you do that, you will submit expenses for reimbursement to Aetna. So you want to make sure you keep all your receipts, all the documents you may receive, any treatment notes, all of that. And then you can go ahead and request reimbursement when you are well enough to do so. A lot of other things about international travel to get a little bit more into the nitty gritty here. I'm going to pass this over to Karen to talk about all the other options that you have through Aetna Student Health Partner On Call International.
So thanks, Cynthia. Thanks, Gail. Welcome, everybody. Thanks for being here. International travel, there are services that are covered that are separate from the rest of the plan in the sense that they fall under more or less emergency circumstances. And it's not something you really want to have to think about when you're traveling away from campus, but we all know that life happens. So better to be aware that these things are there and how to use them and presume that you will never have to reach out. But I'm just going to briefly go over what would happen if, say, God forbid, you decide to go to the Caribbean islands and you're water skiing or jet skiing and then have an injury to your leg and need to be relocated to a qualified hospital. So there is something called emergency medical evacuation. What that is if, God forbid, something happens to you, whether you're skiing down the Alps or you're on the islands, and you need to be airlifted out of a situation, brought to a certified, like a qualified medical facility that is capable of treating you, not just a small, like a pop-in clinic, but you want to go to a certified care unit. If you call Online International, who's one of our partners, Cynthia, can you go back to? If you call them, they will arrange for you to be airlifted to the most, not just convenient, but the closest qualified facility based upon your needs. So you want to carry the number that we're going to get to, the phone number and information with you, just in case. Maybe take a picture or the screenshot on your phone just to have it, because to me, it's Murphy's Law. If you have it, you're not going to need it. But it is something that you have to be aware of, that the company needs to arrange the transportation for you, not the other way around. If you arrange it for yourself, it is not going to be covered in the same way. There's medical repatriation. If you need to be relocated back to your home country for the care, that there's a qualifying parameters for that. If you have somebody with you on a trip, or you need to have somebody flown in to be with you, there are some parameters for that as well. Not something we want to talk about or think about, but again, you never know. But repatriation of your mortal remains is also under the umbrella of the international travel component. And there's a $10,000 accidental death or dismemberment piece to it as well. Cynthia, can you go to the next? Okay, perfect. So Online International, or On Call International, my apologies, they do have a 24-hour, 7-day-a-week global response center, whether you're in the United States, in Canada, or anywhere internationally. So again, if you are a traveler, or if you are traveling for the first time, I would highly recommend a screenshot of this, because there's different numbers depending upon where you're calling. You can call toll free or collect from anywhere. Or if it's easier, you can email aetnastudенthealth.com/Columbia and follow the prompts there. But what'll happen is, if you need to use On Call International, they will set up an account and give you a case number. And that case number is going to go with you throughout every step of the process, whether it's relocating you to a facility or getting you home or getting you back to campus. But I have to say, they're a pleasure to work with. I hope you don't have to use them, but they do make life a lot easier if there is a challenge. I also suggest if you are traveling and let's say you're enjoying bopping around Italy and somehow you break your ankle on the cobblestone, hopefully not. But if you do, and you are going to be in a hospital in Italy for a while, I highly recommend emailing your advisor or your school to notify them of where you'll be. And you can always reach student health and let us know if you need assistance with navigating anything with On Call International. Cynthia?
Okay, thank you, Karen. So the last little bit we're going to go through is how to file a reimbursement. So if you do travel out of the country and you do have some medical treatment, you have kept those receipts, you have kept the documents, and now you want to get your money back. So you file the reimbursement to be paid for your benefit. So if you had an office visit that normally costs $30, that's how much you're going to pay. So Aetna will reimburse you for the remaining amount. The easiest way to do this is to submit your claim online. You have to register for an Aetna account first, but once you do, it's really simple to be able to request that reimbursement. So just make sure you have an account on the Aetna website. You could do that before your trip. That would be good. Probably do that now anyways, even if you're not going on a trip. So that way you can see all of your claims online and all of that. So you log in, you select contact us at the top of the page. You're going to want to send a message and select a claim from the drop-down menu. You input all the requested information. You attach a copy of your receipt. You write down whatever information you can. You put in whatever date of service it was. Again, you upload all of your attachments that you have. And that is really all that it takes to do it online. Once you submit the claim, you can check the status of your claim in the Manage Claims section. You can also mail a claim. You download the claim form from aetnastudenthealth.com. You mail that completed form along with a copy of your receipt to the indicated address. You keep a copy of the receipt for your records, and make sure your local address on your account is up to date. Once approved, a check will be mailed. International claims can take up to 30 days for processing. Alrighty, that's really all we have for this traveling. It's really easy to use your insurance, and then request reimbursement if you need to. So if you have any questions, just put them up in that Q&A. We'll start answering whatever we have. It doesn't look like anyone has any questions right now.
There's one more up here. But I wanted to just interject a couple of things that I think are important to note. If you do go to an emergency room or urgent care, whether it be here or across the country, what you want to do, or actually if you're abroad, if you come back to campus and you require follow-up care from that procedure, you will need a referral when you get back within 50 miles of Columbia. So keep that in mind if you do have an injury far away and then need physical therapy. Please pop back into your PCP here at Medical Services in between that care and starting physical therapy back here. And yeah, so the follow-up care is important, just to be aware of that to avoid additional charges.
Very important information about referrals.
Here's a question. Do the students need to have their insurance card with them when they travel? Like say if you're far away, if you're abroad, do you need to show your insurance card to that foreign healthcare provider?
So generally, I would say, since Aetna does not have providers outside of the United States, you won't need to show it. However, some of them do ask if you are covered in your country. I would always recommend that you have it with you regardless. If you're going out of the country, if you're going to Brooklyn, like if you should just always have it. So you can download it at aetnastudenthealth.com. You just select your school, which is Columbia, of course, and you put in your uni, your date of birth, and your digital ID card will be there. So you can save that to your phone. Aetna also has an app that you can have handy as well. So that's a good question.
If I were traveling abroad, I would absolutely download the Aetna app, and I would download it regardless because that contains all of your information in one place on your phone. And it actually makes it easier to look up claims and things of that nature.
It looks like we have a couple of questions that have just come in. So one, should a student still go to an in-network Aetna provider if they are in the United States, or is it the same, or does it not matter?
That's a great question. Cynthia, you want that or you want me to?
Go ahead.
So it's always preferred and highly recommended to stay in network. In the United States, Aetna has a vast network of providers. So same thing. The only difference is you don't need that referral more than 50 miles away. But if you do not go to a network provider, then you go to the penalty of an out of network. You start paying towards the deductible and your fees can be higher. So it's definitely recommended, no matter where you are in the United States, to do a search for those in-network Aetna participants. When you are out of the United States, like Cynthia said, there is no international specific network, but Aetna does reimburse at an in-network rate if you are out of the country.
Great. Thanks, Karen. And this one is for either of you. Can students make a medical appointment on campus during the break?
Cynthia, or do you want me to?
You can go ahead. I'm not sure of the hours during the break.
I was just going to say the hours, I would check the hours, but the upside is that there is 24/7. There's somebody answering calls and returning to students 24/7. So if someone does not pick up on the phone, if you have something where you need to get in, leave a message because someone will absolutely get back to you and coordinate care according to what your need is. So I think the answer is yes, but it might be a little bit of a delay in scheduling things. But absolutely reach out to medical services like you normally would for any kind of situation where you need to speak to them. The difference is you might just have somebody returning the call versus picking up immediately.
Correct. And you'll still be able to get a referral as well. All right, I think those are all we have. We are available to you. Our email is up on the screen, studentinsurance@columbia.edu. We are here if you have questions. And go ahead and reach out if you do.